Unemployment is higher than it's been in decades. The housing market's in distress. There's an out-of-control federal debt and deficit. More and more middle-class Americans are feeling squeezed by irresponsible decisions being made here in Washington. This health plan being forced on America under phony, tight timelines bites off too much, fails to deliver on promises, and passes the costs on to hardworking Americans. It's important for the American people to understand how these bills will actually increase their health care costs. And I'd like to highlight 10 specific ways these bills will increase premiums for Americans and individuals. Taken together, these provisions will increase costs, they will stifle competition, and they will take choices away from families and individual Americans and small businesses. Number one, the two committee bills rely on taxing the young to pay for the old in what the number crunchers call adjusted community rating. This means that the premium charged to a healthy 22-year-old will have to increase to be much closer to the premiums charged to someone who is much older and sicker. This means young people will pay a lot more for health insurance premiums than they do today. Number three, premiums will increase because of the new federally mandated benefit packages. All plans must include a long list of benefits regardless of what Americans need or want. Why should a 30-year-old single man be required to pay for ovarian cancer screening? If these bills are enacted, every disease advocacy group, drug manufacturer, and health care provider will hire more lobbyists to see that all health plans are required to cover their unique diseases, treatments, and procedures. That's no way to run a health care program. I believe that consumers, rather than lobbyists, should decide the benefit packages that best meet their needs. Otherwise, you'll have more mandates and higher costs. If this bill becomes law, I wouldn't be surprised if every plan in America is required to cover massages and acupuncture. I'm not saying people shouldn't get massages and acupuncture if they want to pay for them. But I don't think all Americans should be required to roll in a plan that covers every single benefit. Number six, premiums for health insurance will increase when 14 million more Americans are enrolled in the Medicaid program. Several studies have highlighted how Medicaid's inadequate payments to doctors and hospitals directly increase costs for everyone else by forcing these providers to make up for their losses under Medicaid by shifting those costs onto private purchasers. The current health reform bills include the biggest expansions of the Medicaid program since it was created in 1965, while doing nothing to address Medicaid's inadequate doctor and hospital payment rates. If you can't see a doctor, you don't have insurance. This will mean that billions of dollars in additional costs will have to get shifted onto individuals who already have health insurance, thereby driving up their premiums. Nearly 40% of doctors won't see Medicaid patients because of the low reimbursement rates. As I said, if you don't see a doctor, you don't have health care. Number 10, premiums will increase because of the new tax for comparative effectiveness research. Washington bureaucrats will tax patients so the government can decide which treatments are acceptable and which treatments are denied. Rationing? We've seen this story before in other countries such as England. We know that this will lead to the delay and denial of care for our seniors. It's no wonder that a recent Rasmussen poll noted that 59% of our nation's seniors oppose the current legislation. No American should be denied health insurance because they have cancer, diabetes, acne, or other pre-existing condition. No one should lose their health insurance because they forgot about an old injury when they filled out a form. No one should be denied health insurance, period. Mr. President, we need to enact reforms that will actually reduce costs and make health insurance more affordable. That's what the American people want, but unfortunately, that's not what the current bills do.